We're going to talk today about spinal pain and then chronic musculoskeletal pain kind of together. And you can hear me in the back? Okay. All right. Well, very good. So we'll go ahead and get started. So we'll frame the issue. How many people in the United States have problematic back pain at some point in their life? I hear 90%, 80%. That you're right on. So you're right. So almost everybody, 84% of people have problematic back pain at some point in their life. So it's just a very common issue. Usually it does get better given some time, but there's a subset of people that can have chronic issues. So the prevalence of chronic back pain, anybody want to venture a guess? People that have most people have some amount of back pain at some point in life, 84% of people, but a subset have chronic low back pain right now. And this is according to the Lancet. It is 23% of people have back pain. And what percent of people are disabled by low back pain? It's pretty, so 11 to 12% of people. So it's a common issue. If you don't have it, you know somebody that does have it. And so we're going to talk about that today. And the American way is there a pill for that, right? Is there a pill for that? Do you have a pill for that? So to frame, and not to cast any shade on the medications, but I kind of mention the common things that are used. And some of these can be helpful, but in general, they probably have a more modest effect. So the anti-inflammatories, they have a known issue with GI side effects, can affect your kidney function, they raise risk for cardiovascular risk, and they have a modest benefit. Muscle relaxants maybe have a modest benefit for short-term, for acute back pain. Some of the antidepressants are used for like nerve pain, but I think I mentioned some of those in a lecture on Monday. More of a modest benefit. Gabapentin, common medication used for neuropathy and nerve pain and other sorts of pain. The classic studies on these suggested that 30% of people got at least 50% reduction in their pain. So that's pretty good for 30%. But on average, if you look at all comers, there's about a 2-point drop in pain for neuropathy. And placebo in these studies about a 1-point drop in pain. So maybe a 1-point difference in placebo. There's a subset that may do very well with it. But these do have some limitations and there's side effects. Opioids. So the short-term benefit, if you have a fracture or something like that, it can be very helpful. There's really no long-term studies beyond 6 to 12 months out. And we know the longer you're on these, you could develop a tolerance. It's well known in animal and human studies to affect hormone levels like testosterone in guys, estrogen in females. Over time, there's something called opioid-induced hyperalgesia. You get like increased sensitivity to pain. It's known to be toxic to the brain. They've done MRIs in certain parts of your brain. 1 month on an opioid will start to shrink. It suppresses breathing, causes constipation, and there's even like poor healing when you're on these medications. So acutely, they may serve a purpose. Long term, some people, this is how they survive, but long term, the data is not as favorable. So we're going to talk like what are some other things you can do outside of medications, typical things you see. So we're going to go through these 7 things here. We're going to start with smoking. And I'm preaching to the choir on most all these things. So you can take it with a grain of salt. But smoking, multiple studies have associated smoking with low back pain and disc degeneration. And chronic pain, people with chronic pain who continue to smoke, we tend to not see improvement. That's what the studies suggest. And there's increased pain intensity that actually improves when you stop smoking. This was in a veteran study. So why would that be? What is it about smoking that is bad for the spine? Anybody want to venture a guess? Circulation, calcium, okay? Yeah. Okay. Carbon dioxide? Not carbon monoxide. Okay, I got you, yeah. So we're going to come back to that. So I heard some very good ideas of why that is. Move on to weight. Again, we know that people who are obese, it is associated with increased incidence, prevalence of back pain. You're more likely to seek care for back pain if you're obese. And addressing weight is key for success long-term if you have back issues. So that's a key issue. What percent of Americans are either overweight or obese? I just looked this up yesterday. I found out what are the CDC, and it came out in 2024. That's the last one I could see. So if you compare overweight BMI of 25 and above to obese and morbidly, including everything, if you had to guess, what would be the percent of Americans who are overweight and or obese? I hear 60, 50, 70, 80. That's closer. So 72% of Americans are either overweight or obese. And then the percent of Americans, I think I had quoted in a prior lecture from 2024, they said, how many what percent of Americans are obese? So it is 40.3 is what I just read from 2024 for the CDC had put out. And then almost 10% of Americans are morbidly obese, so the BMI over 40. And you look, this is a graph from the CDC of the different states and the rates of obesity. So you can look through there. But on average, about 40% of Americans are obese or overweight, I should say. So this was from 1994. Came from the CDC, 1994, 2000, 2015. The darker it is, the higher the rates of obesity is the top one, diabetes the bottom. So there's a real growth over those 20 years or so of obesity. And I just got this from the most recent numbers. It looks like it's leveled off, but it's still about 40%. So it's still very high that with obesity and severe obesity, we're hanging around 10%. So it's not like rapidly increasing like we had seen over those 20 years, but it's still very high. So this is a study looking at people who had weight loss surgery. And going into the surgery, 58% of them had low back pain. After weight loss, only 10% of them had back pain. So I'm not a proponent of necessarily of bariatric surgery, but this is just to show weight loss does help with back pain. Could weight loss affect the architecture of the spine? What do you think? Could it actually make it a little bit better? I'm hearing some yes. Yeah. So this is another bariatric study where they lost surgical weight loss, 81 pounds on average. You can see the BMI is going down from 42, morbidly obese, to 29, which is just under obese, but still overweight. And the disc height, the radiologist was blinded to this, and the disc height, like less stress on the spine, and it actually had more disc height. There's not quite as much pressure pushing on. So the disc height improved. You can see back pain improved. Radicular, like nerve pain down the leg, improved. So weight certainly can play a role in the architecture and the pain that people have. And we know if you're obese, treatments are just not as effective. Both non-surgical and surgical treatments just not as effective. So weight. Could weight loss help somebody who has spinal stenosis? Spinal stenosis is narrowing of the spinal canal. And could that even, I wouldn't think so, but you think could weight loss maybe even help somebody with spinal stenosis? I would have thought, I used to think maybe no, but this is a case report I did when I was in the Atlanta area. One of the radiologists knew I kind of was interested in lifestyle things, and he highlighted, hey, this patient lost weight, and there's many causes of stenosis, but one of the causes that's not infrequent is when you get fat in the epidural space. So if you look here on this is before the weight loss. This is the spinal canal. The dark thing in here is the spinal canal. This is the bony covering. This is the disc. The white stuff in there is epidural space or epidural fat. So when you lose weight, you not only lose weight about on your belly and your thighs, legs, but actually even in the epidural space. You see how it's kind of rectangular? They lost weight and boom, it kind of opens up. So interestingly, if you lose weight and if you have what's called epidural lipomatosis, fat in the epidural space, weight loss could be helpful in stenosis. So it's not all causes of stenosis, but in a certain subset, if you have fat in the epidural space, it can be helpful. You can see at all the levels it opened up. You can see fat around the canal there, and it opens up after they lost. It was, I think it was like 30 pounds, if I'm recalling correctly. 39 pounds. And we know that fat is pro-inflammatory. Fat tissue is pro-inflammatory. So body mechanics. So we'll go body mechanics. You want to be aware of the BLTs, and that's not a sandwich. The BLTs, the bending, lifting, and twisting. We know that there's old studies from the 1970s where they took medical students and they put pressure probes in their discs and they put them in different positions. And these are the curves of pressures within the spine. And if standing was neutral, if you're sitting, the pressures within the disc are a little higher. If you're sitting forward flex, even higher. If you're sitting with weights in your hands, even higher. So that's, mechanics and postures. Those things do play a role in pressures within the disc. And so kind of the proper lifting techniques, things you keep closer to, you avoid the bending and twisting, so forth, takes less stress on the disc over time. So-called text neck. We're all on a phone or a computer or reading something. So-called text neck. Any guesses on how heavy your head is? All right, so I think I heard you had 10 to 12 pounds. And so there's 10 to 12 pounds of stress at the base of your neck. But if you're forward flex, if you look at this little graph here, 60 degrees, it goes up to 60 pounds of force at the base of the neck. So it's like exponentially more. We're all on a phone. Over time, that could cause some issues. So mechanics and so forth. Okay, exercise. So we'll talk about exercise. And by the way, so we have an hour and 15 minutes from 2 to 3:15. Today we'll probably end by 50 minutes. So 2:50. This will be, and if you have any questions at the end, feel free to ask. So we're going to talk exercise. We know exercise is helpful in prevention this is a systematic review, prevention of back pain. It's also helpful in the treatment of back pain. This was a review, another systematic review or meta-analysis that suggested that it doesn't have to be super long, 1 to 2 sessions a week of core, kind of stabilizing type exercises for 3 to 9 weeks seems to be beneficial for people with back pain. So, and these are the national guidelines, the U.S. Department of Health and Human Services. Our guidelines suggest 30 to 60 minutes of moderate intensity exercise 5 times a week, and strength training about twice a week. This is in general, not just for back issues. And I probably fall short on that. Probably most of us do. And when we exercise, the added advantage, we talked yesterday about sunshine, right? We get outside, get a little bit of exercise. In sunshine, studies have been shown, there's really powerful studies for depression and anxiety, but there's also studies about pain, that it actually helps pain. There's a number of studies that getting outside, getting some helps with pain. We're going to come back to that. Vitamin D deficiency is common in people who have pain. People with fibromyalgia, there's a study, average vitamin D levels 4.7. People with spinal stenosis, 74% of them had low vitamin D levels. And it may be just because you're in pain, you're not going outside as much. That might be the association. But there's an association. There's studies saying getting outside is actually beneficial for the pain. So vascular disease. So with vascular disease, what is the largest non-vascular structure in the body? If you had to guess your entire body, what is inside of you that does not have blood flow directly to it? If anybody wanted to venture a guess. Toenails, I hear toenails. Anything else? Okay, I'm hearing something close. Yeah, it's the spinal column. Okay, so you're right. So it's your disc. Actually, the largest non-vascular structure in your body is the disc. So not the vertebrae. The vertebrae have blood, but the disc. This is how nutrition gets into the disc. The arteries and the capillaries, they stop right at the margins of the disc. This is an AI-generated image here but it stops right at the margins of the disc. And it relies on diffusion to get nutrients into the disc and also to clear waste products out of the disc. So it's really important for good blood flow to the margins of the disc, for nutrition to the disc. And so the largest non-vascular structure is the disc in your spine. And we know that we think, well, what are the causes of back pain? Well, genetics we know can play a role in it. Mechanical stress, we're talking about like the BLTs, bending, lifting, twisting, those can play a role in it. Although alteration to nutrition may play a major role in that. So that may be like an underlying issue in a lot of folks. diet. So atherosclerotic disease has been associated with degenerative changes within the disc in many, many studies, both in autopsy and in radiology studies. So this next picture here, this is an autopsy of the inside. They've sliced open, this is somebody that's died, sliced open the aorta, and looking at the inside of the aorta, they've stained fat red, and then inside the aorta, there's branches around the lumbar spine, even higher up. That branch, they're called the lumbar arteries. You see these little holes here? Those are lumbar arteries. So this is one person. This is another person. Who do you think is more likely to have had back pain in their lifetime? The right. It's no wonder if you're not getting good blood flow can lead to some degenerative changes in the spine. So these are studies. So the greater the blockage, the worse the degeneration of the disc. Typically, the average person who had a history of back pain, some of these studies are out of Europe. They kind of had good medical records. They knew who had back pain. Then they looked at autopsies and they put them together. The average person who had a history of back pain typically had 2 arteries in the low back that were completely blocked. This was not seen in those who did not have back pain on average. So one or more occluded arteries or narrowed in the spine, it led to 8.5 times more likely to suffer back pain. So there's a strong correlation. If you have narrowed arteries in the back, more common to have back pain. So it's not only artery flow is not only bad for important for your heart and brain, but also for your spine. And this was a systematic review looking at a number of studies, and they said in epidemiological studies, smoking and high cholesterols were found to have the most consistent associations with degenerative disc and low back pain. So we asked, why do smokers have more degenerative changes of their disc and back issues? The answer would be vascular, right? Vascular blood flow. There's probably many other things. It's toxic from probably other ways, but we know at least from a blood flow perspective. So this was an interesting study. It looked at men ages 30 to 49, and if they had low back pain in the preceding year, they were 4.5 times more likely to have died from heart disease in the following 13 years. So back pain may be like a hint, hey, maybe there's something going on from a blood flow perspective. So this might be the telling sign. So how early does disc degeneration occur in humans? Anybody want to venture a guess? You get an MRI on somebody. How early might you see some disc degeneration in a human? Anybody want to venture? 40, I'm hearing. 20s, I'm hearing. Teenagers, that's close. Yeah. So ages 11 to 16, you start to see some degeneration. There's another study that suggested 20% of teens have early degenerative disc changes. And by age 50, 97% of people have it. So sometimes you take it with a grain of salt. It's like getting a gray hair, but it sure occurs early. These are U.S. studies. 20% of teens have the early signs of degenerative changes of the disc. The question is, what percent of children, if this ties in here, ages 6 to 11 had elevated cholesterol that was not ideal? This is in the United States. This is from a few years ago. Anybody want to venture?
No.
70%?
No.
50%?
20.
20%. So it is 40. So in between there, but it's still high. You'd think, do you have a question?
Could it be scary? You showed us the teenagers. Is it possible that produce obesity?
Oh yeah. So that very well could be. There's probably many players. Obesity, we saw how obesity from the 90s to 2015 markedly improved. 40% of Americans are obese. So yes, I think obesity, I think probably blood flow, the American, they call it the SAD diet, the standard American diet, is probably playing a role. So how early does atherosclerosis, narrowing of the arteries, occur? Anybody want to venture a guess? In our 30s, that sounds 20s. So there's studies actually by age 10, you can start to see some atherosclerosis. And by age 15, everybody has some amount of vascular disease. So if you're sitting in this room, it's not a question of whether you have it, it's how much you have of vascular disease. So on autopsies, by age 15, everybody has some amount of vascular disease. And this was a systematic review, and they noted that plaques appear early in adult life, and by age 20, about 10% of the people have advanced lesions. So it's kind of feel like, well, that's a young age, 10% having advanced lesions in the abdominal aorta. And the prevalence of back pain, this is kind of blew my mind here, that this is looking at 10 to 18-year-olds. And the prevalence of back pain, this is going here like 17, 18 years old, is upwards around 45% of people in the prior year, if you're 18 years old, had back pain. And about, right around 20% of 18-year-olds sought treatment in the last year for back pain. Does that seem like a high number for an 18-year-old? That seems yeah. I have a nephew. He's 20 years old. He just had back surgery within the last year. His, I think, was more like a gymnastic. He was a big gymnast and on Gym Masters and things. But anyways, it's a common issue occurring at young ages that are kind of like, man, this is. Judy has a question here in the front.
So the narrowing of the arteries, is that for everybody, or is that just people who are not die?
So these were like on autopsies of everybody by age 15 in America.
You're really.
Well, you can improve things. So you can certainly improve things, and maybe there's exceptions to the rule. But we're going to talk about that. So the question was, is that the narrowing of the arteries by age 15 in everybody? Is that everybody? According to that study, yes, it was everybody. Okay, another question here on the side.
Smoking.
Mm-hmm.
Back there as well.
Probably it's not helpful. We know there's many things that's not helpful for, and it very well could. Yeah. But okay. Another question here. Then I'll continue. Yeah. Question.
Yeah. Does he have any information what happened for all the Advent study?
Oh well, we'll talk about not the AdventHealth study, but some other studies that give us a little bit of hope. All right. So it's not all doom and gloom. But and there's one last question back there. Okay, so she's highlighting that ladies who use high heels can contribute to back pain. So I'm glad I don't have to wear high heels. Yes. All right. So and this was a study looking, again, a meta-analysis looking at a lot of studies, and they suggested that low back pain is increasing in childhood and adolescence. And you can kind of see that curve. 40% of 18-year-olds within the last year had back pain. So it's increasing. Why is that? Why is it getting? Is there a link between, as was mentioned in the back, the obesity epidemic, the standard American diet, all the vascular blood flow issues? So is there a link? So this is from another radiology study. Who do you think is more likely to have had, who has back pain? This is an angiogram. So this is the aorta, the iliac arteries, and these are those lumbar arteries. So is A or B? B. I'm going to go for B. So actually, this is an image I actually did. The study I was involved with when I was in Atlanta. I sat down with radiologists. We looked at CT scans together, CT angiograms, and so this looks good on this. This is you can see this is the aorta. There's no plaques in it. You can see these lumbar arteries. And those would give good blood flow to the disc. This is the cross-sectional view. You can see the circular aorta. You can see these lumbar arteries that feed around. And then you look at somebody who has calcification. See how there's calcifications there. This is the cross-section. We see how thick the calcification is there and how narrow the calcifications of those arteries. And this is the 3D rendering of the CT scan. It looks like a pretty healthy-looking spine. This does not look like a healthy-looking spine, right? So there is a clear association. Many studies have shown this. There's a clear association. More vascular disease, the more back issues, more degenerative change of the disc, and it starts with the disc, and then you get arthritis in the joint, the small joints, and then can lead to the stenosis. So it says alteration. So disc degeneration has a multifactorial etiology. with genetic, occupational, mechanical influences, but alteration in nutrition has been proposed as a final common pathway. If you have good blood flow, you're more likely to do better. So any practical applications here? So any practical apps? So we're going to go on here to diet. Is there any kind of, so this was a study by Robert Vogel, who used to be the chairman of cardiology at the University of Maryland. And they did this test where they put a tourniquet on the arm, and they put it on for 5 minutes. And I've heard that's a non-habit forming activity because it gets painful. They let it go and they put an ultrasound, and the artery should dilate, like it's starved for oxygen, and it'll dilate. So that in one group, they gave an Egg McMuffin and hash browns. Another group, they gave cornflakes. And so they looked, what happened to the arteries when they looked under ultrasound? Well, the cornflake group, there was no change. This is the ability of the artery to dilate when they looked after the 5 minutes. But the Egg McMuffin hash brown group, the arteries diminished in their ability to dilate for about 4 to 6 hours, up to 6 hours before it's starting to come back to baseline. So if you imagine you're eating 3 meals a day, McDonald's, those type of things, it's kind of a repeated insult to your arteries and your blood flow. So this is the pictures. One of these two people just ate a cheeseburger and a milkshake. Can you guess which one? The one on the right. You see how thick it is, and yep. So is there any? You're asking, is there any like AdventHealth study? I think there's a couple of studies, and we've highlighted some of these earlier in the week. But Dean Ornish out of California, he was the one that in the 90s showed he took people with advanced heart disease. Again, who had arterial diseases like we looked at. He put them on a whole food, plant-based diet, exercise, stress management, and they were strict with their diet. Plant-based, they excluded oil, exercise, stress management. At 1 year, 82% of people had opening when they repeated imaging, and 90+% of people symptomatically did better. So even the people who didn't have opening on imaging, symptomatically, the vast majority did better. Caldwell Esselstyn at the Cleveland Clinic, 70% of people saw opening when they repeated imaging. He did a larger case series of 198 folks who had heart disease, advanced heart disease, and put them on a whole food plant-based diet. They followed them for about 4 years. Of those 198, 177 of them were adherent, and 21 were non-adherent. Of the ones that were adherent, only one had a recurrent event. And of the 21, 13 had recurrent events. So the difference was a 0.6 recurrent event versus 62%. So 99% of people avoided recurrent events, cardiac events. And we have a question in the front.
Well, that's me. These plant diet had no oil.
Correct.
Although you can get up in a plant diet and a lot of
Correct. Yeah.
oil and fat.
Yeah. So she asked, Caldwell Esselstyn is very strict on his diet with no oil, as was Dean Ornish. So the only two people who've really shown these things was on a strict plant-based diet, and they both excluded oil. Dean Ornish did exercise and stress management. Esselstyn did not. So it was like, yeah, I've gone to his, I think he's now 90 years old, Esselstyn, if I'm not mistaken. And he, if you go, I think he still runs this on Friday, like once a month on a Friday, you can go there and hear his presentation. And he mentioned this study. One person had a recurrent event, but he said really that person had fallen off the diet. But he said nobody would believe that 100%. So he included this person just to say, hey, because people wouldn't believe 100% of people did better. But so you're correct. They were very strict with those studies. 27% of people avoided bypass and stents. And this is from Esselstyn. This is a stress test. You can see this is a lack of blood flow in this part of the heart muscle, and getting better blood flow within 3 weeks. So it occurs quickly, within really 2 to 3 weeks. This is 3 weeks, but it's noted if you go strict on those diets, like within 2 to 3 weeks, you get better blood flow. So if you have bad blow for the spine, there is hope. This is another study. I showed this earlier this week, but lack of blood flow, diseased artery. This is over about 2.5 years, and they repeated the angiogram, cardiac catheterization, and it opened up. We know plant-based diets have have been shown to reduce markers of inflammation. So like the C-reactive protein, high-sensitive CRP, the SED-rates ESR. If you look at a system, this is a systematic review of 21 studies, and they're comparing like a fully plant-based diet versus a meat-eating diet. There was a significant drop in the C-reactive protein. So eating healthy can lower inflammation. And intermittent fast, we talked, was it 2 days ago, about intermittent fasting. So there are studies that intermittent fasting lowers markers of inflammation. Studies have shown improvement in fibromyalgia and lower markers of inflammation. And most of these studies are 8 hours of eating, 16 hours of fasting. And the studies do say that the earlier you do that in the day, the better the anti-inflammatory effect. And it's only like water between those meals, giving your gut some time to rest. So that's the diet piece of this. Other options. Are there any other options besides everything we just mentioned? We have quite a few other things we can mention, but I'll hit a few of them. Turmeric. You all are probably very familiar with turmeric. So it has been, I go into PubMed, you type in turmeric or curcumin, I pull up like 19,000 articles that have that in the title. So there's a lot of studies that come out on turmeric, and typically in the range of 1,000, you go 500, but 500 up to 1,000 or 2,000 milligrams a day. Interestingly, if there's black pepper or peppering, it significantly boosts how much is absorbed. And you want to avoid this if it helps with inflammation. Like studies show in the big systematic reviews, it lowers markers of inflammation, helps with pain. But if you're on a blood thinner, like warfarin, Eliquis, that type of thing, it potentiates bleeding. So you want to avoid it if you are on a blood thinner. If you're very prone to kidney stones, like specifically calcium oxalate stones, there's a theoretical risk it could potentially worsen that. If you have gallstones, it actually causes some gallbladder to contract, like to prevent gallstones. But if you have them currently, then maybe it's not the best thing to do. And if you're pregnant, probably better to avoid it. And a number of studies have been looked at this. As I mentioned, the systematic reviews suggest it helps with arthritis, pain, and inflammation. Even the blood markers, they notice a diminishing. And some of the studies suggest the effects may be similar to that of an anti-inflammatory like ibuprofen relief. So this is better trial. The anti-inflammatories, we mentioned the side effects, GI ulcers and kidney function issues, heart attacks, strokes. So this would be an alternative to that. Another one with a lot of good studies is boswellia, also known as frankincense. And you go 500 milligrams twice a day. And the systematic reviews of that suggest it helps with inflammation, pain, and arthritis, lower markers of inflammation. Better than placebo, and I've had some patients really tell me this has been very, very beneficial. A question on that?
Question on the turmeric.
Yeah.
A lot of
Sure. Yeah, put it as spices on foods. The question is, does it count if it's on Indian food? Yeah. Any form, you can do it. You can get it in the produce aisle. I've had people just get in the produce aisle and eat it, but it's a little hard to do. You can get the capsules, you can put the spice on your food, so forth. Yeah. Yes, somebody said the oil is the problem with Indian food is what. Wait, another question. The question is, how much is 1,000 or 2,000 and a tablespoon? I would have to I don't know if you've seen some of those capsules. Those are the pretty large is 1,000 milligrams. So it's less than a tablespoon would be more than 2,000 milligrams. I'd have to look that up, but that tablespoon would be more than 2,000. Okay, so we heard a quarter teaspoon or tablespoon. Turmeric, yeah. Okay, a quarter teaspoon. So the powder. Okay, 1,000 is a quarter of a teaspoon. That's just what you said? All right. Thanks for the feedback, everybody. Yeah. All right. So there's good data on things like turmeric and boswellia. Oh, question, sorry.
Yeah, on the boswellia, it says give it 4 weeks. Does that mean 4 weeks before it's going to take effect?
Yeah, I would say, the question is, do you give it 4 weeks? Yeah, I would give it 4 weeks to kind of see what kind of benefit you're getting before you give up on it, is what you may not notice it right away. But some people do notice it pretty quickly. Okay, another 2 questions here. Greg? A comment from Greg.
The person out the jojoba oil is the best carrier for frankincense.
Okay, the best carrier for frankincense is,
Jojoba. Well, I think that's how it's pronounced.
okay,
The Spanish is spelled Jojoba.
jojoba is the best. Okay, and is okay. And another question or comment back here. Oh yeah, so so some people do get a little bit like the GI, like esophageal, like I feel like there's some reflux or just doesn't. So some people don't tolerate it and just look at other options or go lower dose, take it with food, so forth. But yeah, some people, it's pretty well tolerated except for those things I mentioned. And same with Boswellia, sometimes a little reflux, but it's generally very well tolerated with that. Okay, another question here. So in looking that up, it may slightly potentiate bleeding. So you want to probably be cautious, definitely with turmeric, possibly with Boswellia. So you want to be cautious if you're on a blood thinner with both of those, but definitely turmeric is well known to potentiate bleeding. And Boswellia, it says maybe. Yeah, so the question is black pepper has been shown to like significantly boost absorption of turmeric. So most of the capsules will have, let's say, black pepper or pepperine in it. Yep. So if you're on a blood thinner and it doesn't have black pepper, you're saying, is it okay? I would still, if you're on a blood thinner, I probably wouldn't use it. Yeah, there's probably more potential risk. Yeah. So, okay. And there's other things like, there's a lot of studies on things like ginger, tart cherry juice, a lot of them, like ginger as well, if it potentiates bleeding. So you want to be cautious if you're on a Xarelto or some of those Coumadin and warfarin type medications. So water, another thing, there are studies if you're dehydrated, a lot of us don't drink enough water. And if you're dehydrated, you're more sensitive to pain. So making sure you're drinking enough water every day. Near infrared, we talked about this, was it yesterday? Yesterday we talked about like sunlight and near infrared. And somebody asked yesterday about some of these devices that are marketed, like the mask and the caps and the things that give you light. So a lot of the studies showing benefit are with those devices, but they're at a specific wavelength. You go outside, you get the full spectrum. So probably outside is better. But those things appear to work as well. So this is one. So there's good data for near infrared for pain, or I would say moderate data. There's moderate data for fibromyalgia, and there's probably modest data for back pain. And I'll show you one of the more impressive studies here. So this is a company that has their own. You always kind of wonder if it's kind of an industry-sponsored study, but they have their own near-infrared device, and they looked at pain and quality of life, leisure activity, and catastrophizing with near-infrared. So what they did was a randomized control trial. The participant was blind. It was blind to the participants, and the evaluators were blinded to what they got, and they got near-infrared. They got red light 660, near-infrared at 850. But not the full spectrum, just 850. They did it 3 times a week for 4 weeks, and they worked up to 20 minutes. So just for 4 weeks. And what do they see? So I'm going to kind of try to show this here to you. So at 4 weeks, at 4 weeks. So the blue lines here are the placebo, where they didn't get the treatment. The orange is where they got the near infrared. And if you go out at 4 weeks, they start noticing improvement of pain. Pretty much they're out. So there's a clear difference. And that's fairly significant. That was looking here. Pain started around an 8, and it dropped down, around a 4 to 5. There are a lot of those points. This is quality of life, and just there was improvement within a couple weeks. compared to placebo. This was a randomized, controlled, double-blinded study showing improvement of quality of life, and then leisure activity improved as well. A lot of people with fibromyalgia, like they don't want to get outside because they're sore and things that aggravate them, but their activity improved, and this is kinesiophobia, like fear of being active. So they got more active as well. So to me, this is a pretty powerful study that near-infrared, this is red light and near-infrared, may have a fairly potent effect. And so I would say, but even better than this is just getting outside. And you don't have to be in direct sunlight because remember, near-infrared, if you have a long sleeve shirt on, it penetrates clothing easily. We said yesterday there's a study that penetrates the entire body. We thought it was maybe 3 inches, but a study that penetrates the entire body. So even if you have a hat on and long sleeve clothing, infrared penetrates. And there's studies on back pain as well. There's randomized controlled trials suggesting a moderate improvement of pain. You can see the wavelengths that are used in the 800s to 1200s with pains. This one from a 7 down to a 3, 5 down to a 3.6, so more modest. But there's some studies, randomized controlled trials, suggesting it even helps with the back, non-specific low back pain. A question? So what spectrum? The best studies are in the near infrared, which is like around 700 to 2,500, and most of the studies are around like 800 to 900 nanometer wavelength. So that's generally, and if you go like into a sauna, like there's some traditional saunas and there's infrared saunas. Infrared saunas are in the far infrared, so that would not be effective at penetrating deep. It's the near infrared that's helpful. So there's saunas, there's traditional saunas and there's infrared saunas. Infrared saunas use far infrared, but those are not the ones that are showing to be helpful in back pain. They don't penetrate as deep as near infrared does. And it's the near infrared that, like we talked yesterday, gets the mitochondria, has the less oxidative stress, helps produce energy. So the saunas do help for heating you up, and I think there's some benefits from that, but it's not this type of stuff. So what might be better, like getting outside, because you get the full array of that. So now the last thing to kind of highlight here is people sometimes you've heard of, or maybe you've experienced, you had, whether it was COVID or the flu, you had some kind of illness, and afterwards you just feel fatigued, you start having pain. And so there's the long COVID people. So there's some interesting studies on long COVID where it appears that these people who had a lot of them, maybe not all of them, but a lot of them appeared to have a persistent viral infection, like their body just never quite cleared it. And so you see a chronically elevated interferon levels. And we talked yesterday, interferon is part of the it's one of the key players in the innate immune system. You have the natural killer cells and the monocytes, the eosinophils, but interferon is one of the key players in the innate immune system. The adaptive is when your body's been exposed to something and antibodies come and kill off whatever the virus or bacteria is. But interferon is one of the key parts of the innate immune system. And people who, with post-COVID, long COVID, with chronic fatigue pain, you should see where there's high interferon levels when you're infected. When you recover, the interferon levels go down. But people with long COVID have just the opposite. Their interferon levels remain high because they're still trying to fight off a virus or like maybe a low level, something going on. So, and it was noted in some of these studies, like after a vaccine, people with long COVID, they'd actually do better. And then you can see here where the interferon levels diminished before versus after, and correlating with some of their symptoms. So they felt like once the virus was taken care of, a lot of the long COVID symptoms tended to get better. And this could apply more than just to COVID, but like post-flu or other illnesses. And hepatitis C is a very similar model where it's a low-grade chronic infection. Now there is a good treatment, some antivirals that has like a 95% cure rate, but interferon is chronically elevated unless it's treated. So there's a chronic infection, chronically elevated interferon, like the body's trying to fight this. And it used to be the standard that interferon, pegylated interferon, was used plus an antiviral to treat it. So the treatment is to try to overcome the illness. And so is there anything that could boost interferon to fight a viral infection? So I'm going to pose this question to you. Is there anything we could do to boost your interferon levels? Okay, what am I? Say again? Sunlight, okay. Hydrotherapy, all right. What Dr. Tryon was talking about yesterday, hydrotherapy. Exercise has been shown to boost interferon, but yeah, I was highlighting interferon. In fact, I heard just a couple days ago, you all know Neil Nedley. Most of you know who Neil Nedley is. He was talking about a person that came to the facility, had chronic fatigue and pain and such, and all the labs, thyroid, everything was normal, but they couldn't. And so they finally figured that the labs came back positive for Epstein-Barr virus. Like there's a subclinical viral infection that just didn't get cleared. And so they put them in hydrotherapy, like water immersion. And lo and behold, the person got better. So if you're in this situation, maybe that's one way to try to attack that. And this is highlighting what was said yesterday. By boosting your core body temperature, just a little bit, you can significantly boost interferon. And this was like an in vitro, like cells in a culture. Once it went from up to 102, boy, there's like a tenfold increase in interferon release. This is not in vitro, not at but this is an animal model. By just increasing a little bit, like the 100.4, it upregulates the genes and interferon. So it doesn't have to be a huge increase in your temperature to fight those off. It turns on genes that target the viruses. And this is a water bath, 103 degrees for an hour, improved monocytes, which is also part of that innate immune system. So how can you do this? I'm repeating what Dr. Tryon said yesterday. Contrast showers is one way to do it. Hot water immersion or a hot tub, saunas, or fomentations. And a little quiz here. Do you remember which was better at raising your core body temperature? There was a study compared traditional saunas, infrared saunas, and hot water immersion. Hot water immersion did better. It was your body heats up a little bit better with that. All right. Question.
What is the hyperbaric chamber do?
Yeah, so maybe somebody else has it better, but that's a high pressure. You get more oxygen there. That might have a benefit, but I don't know. Like maybe it would, but I don't know the data on that. The question was, what does a hyperbaric chamber do? It's higher pressure. You do get more oxygenation, so it very well could have some benefit, but I don't know.
But it doesn't raise court.
Yeah, correct. Yeah.
How the body spread?
Yeah, so I think there's probably a lot of things that it's beneficial for, but I don't know, like wounds and a lot of different things but I've heard people really sold on hyperbaric chambers, and they're probably right. But it's the same thing as like eating healthy, getting better blood flow, and so probably would have a role. I don't know that it's been studied though for this type of thing, but I don't know the data on it, so I'll have to defer. A question again? What? Salt therapy? Ooh, I don't know. Somebody else may have a better question about salt therapy, like Epsom salts, that type of thing. Oh, I see. You go to like a room breathing in this. I don't know if somebody else may know that. I told you the story about Neil Nedley. Yes. Yeah, so that is part of the question here is what about fomentations? So that does a good job at raising, and here's if you want like how you do fomentations, these are some websites here. But I think essentially they try to get everything hot. They keep the head cold, but they have like a layer of cloth or towel, and then to put hot towels on top of them, and it does a good job at raising your body temperature. Very well. Yes. Yeah, for sure. Yeah. That could be helpful. So for the back pain. Okay. Fomentations has a number of health benefits. Yeah, for sure. I mentioned about Neil Nedley. And so in summary, what % of people will have problematic back pain at some point in their life? Most of us, 84%, right? 84% will have problematic back pain. So you're lucky if you don't. Why is smoking associated with back pain? So it's a blood flow problem. That's a major, major factor. And what is the largest non-vascular structure in the body? The disc. And how long does a fatty meal, how long does it take for a fatty meal to cause vasoconstriction where it doesn't dilate? Yeah, so it lasts up to 6 hours. So if you're doing that 3 times a day, it's kind of like a repeated insult to your body. And then how quickly does this change occur? This is that stress test called Esselstyn lack of blood flow to the heart muscle and getting better blood flow. How quickly was that? 3 weeks. So these things occur quickly. So, all right. That is all we have. And maybe we'll take 5 minutes to any questions. Okay, I see a Clemson hat in the back here. So yes, so I would include this. The question is physical therapy and chiropractic, and I would include that in the exercise. So yeah, I think that's reasonable. I see. Yeah. So I think sometimes the contrast, the heat, 10 minutes, ice 5 minutes. That's been an effective thing. Can be very helpful, and we underestimate how effective some of those things can be. Okay, question in the back there.
I was asking what
Refers what? Sven decides that I would buy an inverting table and do it myself, and I'd never been back to your
Okay. So the question is about inversion tables and traction or inversion tables. I think it can transiently take some pressure off the spine, and there's little harm in trying something like that as long as you can tolerate, putting your head, if you have like the cardiovascular health, to do that. But yeah, I mean, some people find that to be helpful, and it's a low risk thing to do.
What about
Pool therapy, like aquatic physical therapy, or are you talking like hot pools or that what? Yeah. So I think that is very helpful. I think there was a study that Dr. Tryon mentioned that it helped like with interferon levels and things like that. Just getting exercise in general can be helpful. And so some physical therapy places will have aquatic physical therapy for people who have a harder time doing things otherwise.
Could you have others to be a what? Or
It's just,
what type of act?
so yeah, so the question is what type of exercises to do. Like some of those review studies have suggested like some simple, it doesn't have to be super intense, but just on a regular basis, some core exercises and some aerobic exercises can be helpful. Core exercises. And I have handouts of things you can do, not with me, but some core stabilizing. A lot of the reviews talked about like Pilates and kind of slow stabilizing exercises. And they're talking like twice a week or something like that. So the question is, this person had a question about traction, but same thing. Traction is an easy enough thing to try, as he had mentioned. Some people find it very helpful.
Yeah, well, 16, 17 years ago, I asked the probably if and they gave me about 6 or 7 breathers, and
Yeah. Stretching helpful. Okay. All right. I don't see any other hands. Oh, I do see a hand. Okay.
I just have a comment. Maybe I'm the only one with this, but that distressed me about how young children, 10 years old, but I wonder what's going to happen with gamers and YouTubers.
Yeah.
Sit and do it all day like my grandchildren.
Yeah.
Just to go outside and see do what.
Yeah. So
Wonder.
so the comment is made that there's so many young people having back issues, and now all these gamers and YouTubers, and I hear a lot of kids. I teach Sabbath school. Like, what do you want to? And this is not the but I hear people like, I want to be an influencer. Like, okay, you want to sit in front of a computer? So yeah, I'm sure that could be an added problem. Yeah. So
wondering what it's going to be like.
Yeah. So question. Yeah, that's not favorable.
It's not eating good. Usually snacking it.
Sure.
Right, devices all day long. It's not exercising, not going outside.
Yeah. Multiple hits.
I was the only one doing that, but
Yeah.
staying stressed,
Yep.
but I worry about that.
Yeah.
About that heart and lung and sunshine and
Very good. Yeah, I agree. A lot of things and there's two questions about acupuncture. So there are studies that we don't know how everything works, but there are studies that it's better than placebo. So I think it's low risk type thing as long as it's not going like around your lungs and causing a pneumothorax. But otherwise, I think they're reasonable. All right, I do see.
What? I have a question about scoliosis with Senate's therapy.
Yes. There are some like specific physical therapy. The question is about scoliosis, and there are some like special physical therapists that are trained specifically in scoliosis. And like I saw somebody here, I think Monday or Tuesday, that was telling me about their physical therapists with their that are trained. So yes, it's definitely things in motion tend to stay in motion. We encourage you to stay active if you have scoliosis as well. One question there, and then here. Okay. So the question is about walking shoes, thick soles versus thin soles. And I don't know I have a good answer for you. But I do know there are studies on people who don't wear shoes. They don't seem to have the same foot problems that we do. The thick sole versus the thin sole, like a more minimalist shoe, like some runners like to go run with those minimalist shoes versus the Hokas or so forth. Yeah, I don't have a good answer like which is better. You may have to do a little trial and error. There's not, good data for me to know.
No.
Sciatica pain. So sciatica pain in like 90% of people, if you have sciatica pain going down the leg, like a pinched nerve in the back with pain down the leg, 90% of people, it gets better within the first 3 to 6 months. So usually the best thing is you give it some time before you get too aggressive with things. Yeah, but there's a subset that may need surgery, but majority don't. Yeah. All right.
I can't